Hello and welcome. I'm Dr. Tina Ray. I'm an educational and child psychologist. Today I want to talk to you about the power of best breathing for panic attacks and anxiety. We've just begun this week the exam season, and lots of children and young people that I'm in conversations with currently are really quite anxious about actually going into the exams, being able to remain calm and really focus on what they've got to do. And I think this is quite significant given the fact that we've had this COVID pandemic, and for example, many of our A-level students haven't actually been at a formal examination setting for quite a few years. So the lack of experience in this area has, I think, increased levels of anxiety. So I think it's really important that we actually think about how we can support our children and young people to really focus in and gain some level of control over their anxiety at this current time. So we know anxiety is a normal reaction to threat. It includes physical, emotional, and mental responses. And these include an increase in adrenaline, feelings of worry and confusion, and thoughts about danger and the worst possible outcome, catastrophic outcomes. And for many of our children and young people at this current time, this is something that they are increasingly experiencing. But we also know that it's normal to feel anxious. It's normal to feel anxious at certain points in our lives when we're having to do something new, when there's a big change happening, and of course, when we're faced with exams and assessment processes. I think the issue for all of us really is that when we have those chronic or high levels of anxiety, this really can prevent us from just engaging in everyday activities and being able to kind of complete tasks that we would normally be able to do relatively easily. So it's really, really important. It's when there is that sense of overwhelm and that we are in a position where anything might trigger that anxiety, that's when I think it's potentially far more dangerous for us. And this very often can be the precursor to panic attacks. And these are those sudden episodes of really intense anxiety that we can all experience, children, young people, and adults alike. And it really is a sense that whatever's going to happen is going to be absolutely dreadful. We will have those physical symptoms, such as a racing heartbeat, shortness of breath, or feeling really sick. And sometimes we don't know the exact cause. This can be a combination of things, the current situation, being in that exam room, the stress. Genetics also play a part alongside changes in our brain function. So it's important that we don't underestimate the complexity of panic attacks themselves, but also that we're aware of those symptoms so that when we experience them or begin to experience them, we can take action and have a plan ready in order to be able to cope with this more effectively. Sometimes they just happen without warning. We don't feel or we're not aware of those triggers. And that's the problem, I think, for some of our children and young people at this time. The panic attacks normally last between 5 to 20 minutes, but we know they can strike at any time and they can be more or less frequent. So there are some very simple things, simple pieces of advice that I think it's important to share with our children and young people. It's vital that we really focus on our breathing in order to regulate. This is essential. I'm going to really focus in on this in the second part of this mini presentation. Also grounding ourselves, just being in the moment, looking at what's around us, 5 things I can see, 4 things I can hear, etc. Grounding our feet, our soles of the feet into the floor at that time, being very conscious of what is going on in the context. And I think that's a really important top tip, because very often it's too tempting to just to flee the situation. We can also engage physically, so simply jumping up and down or jogging on the spot, anything that's physical and not too difficult or demanding, and then focusing on our breathing while we're doing that. It's also helpful to engage in some self-talk, and that positive self-talk alongside affirmations, obviously, but just reminding ourselves that this is going to pass, it's not going to last forever. It's just anxiety. It's my anxiety manifesting itself, and it can't actually harm me. I can and will be in control. And I think we can say that in our heads or out loud if we feel able to, if that's particularly helpful. I also think that it's important after we've experienced that moment of panic that we really do recognize the level of draining kind of that gives us physically and emotionally. So it's important to actually go somewhere very quiet and allow ourselves the time to just get back to that more of a sense of physiological calmness and safety. And we might need something to eat, we might need a drink usually. I also think that talking about it is crucial. It can really, really help. And we know this. Sometimes that fear in our heads, once we actually speak it out, it's almost like we've instantly halved it to some extent, because basically it's almost like the elephant in the room. When we don't talk about it, it becomes bigger and bigger and more of a problem. Once we share that worry, once we share that anxiety or concern, we find that actually if we do that with a trusted adult, someone who can really empathically listen to us, that we can gain more of a sense of calm and understand how to process, how to cope and manage more effectively. I think journaling is also helpful, just keeping a record. What happens to us when we have these attacks? What's helped before? What might I use again in the future if this should happen again? Very important, that notion of a mood journal, just keeping track of what helps us over time. So it's a positive move, that. I think all of us, adults and children alike, need to think more about the power of breathing. It's absolutely crucial. I found this wonderful visual, and I've referenced it here, and it just really reinforced for me the power of breath, the power of effective, good breathing in terms of reducing anxiety, because it reduces the heart rate, relaxes the muscles in our mind. It also allows us to shift our mind away from those worries and concerns onto the breath, and that helps us to connect more to ourselves. It's useful for sleep patterns, for restoring sleep, because it actually signals our parasympathetic nervous system to calm down. So using really good rest breathing techniques when trying to go to sleep at night is really effective and helpful. I also think it's just about slowing us down, being more mindful, therefore also increasing energy levels, boosting our immune system, and overall just really helping us to manage our stress more effectively. And of course, there is something extra here in the digestive support that breathing properly also supports us with, because it increases blood flow. So it helps us to digest our food. And I think that's really, really important, because sometimes when we're anxious, we feel very sick and we don't feel like eating. And that's a dangerous pattern to become addicted to, in my view, too. The breathing is key. Hygromatic abdominal breathing. This breathing is that type of deep, even breathing that engages our diaphragm. I'm very keen on this as someone who used to do a lot of singing. Using the diaphragm and breathing from the diaphragm was essential to good breath control. So very, very important, allowing our lungs to expand and creating negative pressure that drives the air in through the nose and mouth and fills the lungs. And this is how newborn babies naturally breathe. And we also breathe like that when we're in that relaxed stage of our sleep. Thoracic or chest breathing comes from up here in the chest. And this is really short, rapid breathing. And we know that's how we breathe when we're anxious. Okay, so it's very important that we can distinguish between the two. And the easiest way to do this is to put one hand on your upper abdomen near the waist and the other in the middle of your chest. So as you're breathing, you'll notice which of your hands raises the most. You really want the hand that is just in front of your abdomen, okay? That's really, really important. And we need to be more aware of this in stressful moments. So a very simple thing that we can do is actually just try to use that particular technique. One hand on my diaphragm, abdomen, and one hand higher up onto my chest, and see which one is rising the most. There are lots of different techniques. I'm just going to ping through a few of them now. Alternate nostril breathing. Again, these are very, very simple techniques. So simply positioning your right hand by bending your pointer and middle fingers into your palm, leaving your thumb, your ring finger, and your little finger, okay? Then closing your eyes and gazing downwards, inhaling and exhaling to start with, and then closing off your right nostril with your thumb, inhaling through your left one, closing your left nostril with your ring finger, opening and exhaling through your right nostril, then inhaling through your right nostril, closing off your right nostril with your thumb, opening and inhaling your left nostril, and then inhaling your left nostril. So you can see it's just very much straightforward, 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 one nostril, the other nostril, but holding the one nostril so that you can only breathe through the one that is not being held. And again, this is something you can repeat 5, 6, 7, or 10 rounds of this until you begin to feel slightly lightheaded, and then you stop and you just breathe normally. Belly breathing, again, American Institute of Stress talks about 20 to 30 minutes of belly breathing can really, really help us to reduce stress and anxiety. And they recommend this as a daily practice. And I recommend breathing as a daily practice per se, but you need to find the right techniques that work for you. So again, just placing one hand on your upper chest and the other on your belly, and then simply breathing as you allow your body to relax through your nose. And then just move into your nose and downwards so that you can feel your stomach rise with your other hand and fall inward towards your spine. Okay. Now, I think, again, this sequence frequency will vary according to your health. Most people begin by doing the exercise 3 times, and then they can work up to between 5 to 10 minutes, maybe 1 to 4 times a day. A very simple one for younger children as well, because it's useful visually, it's an easy one to follow, is box breathing or 4 square breathing. So again, thinking about that visual of the square. So breathing in, exhaling to the count of 4, holding your lungs empty for a 4 count, inhaling to a count of 4, holding the air in your lungs for a count of 4, and then exhaling and just going around that box. So breathing in for 4, hold for 4, exhale for 4, hold for 4. Hand breathing. I love this technique because for me, this is something that you can do very subtly anyway. You can do it under the desk if you're in that exam room or you're in class and you're beginning to feel slightly anxious. And that breathing technique can be used really subtly in so many different situations. So just simply helping you to regulate your breathing, calming your nervous system by tracing up and down your fingers. Okay, breathing in for 4 seconds as you trace up, out as you trace down, 4 as you go up, and 4 as you come down. So you can repeat that as many times as you need to. Pursed lip breathing, again. This technique's really been found very beneficial for those who have anxiety-associated lung conditions like emphysema or COPD. But again, it works also very, very well for children and young people. So just sitting comfortably, relaxing your neck, your shoulders, keeping your mouth closed, inhaling slowly through your nostril for 2 seconds, and then exhaling through your mouth for 4, puckering your lips as if you're giving a kiss, and then keeping your breath slow and steady while you breathe out. So again, practice makes perfect. You can repeat it. Resonant breathing or coherent breathing can help you to get into a relaxed state and reduce anxiety. So again, lying down to close your eyes, gently breathing in through your nose with your mouth closed for a count of 6 seconds, not filling your lungs too full of air, and then exhaling for 6 seconds, allowing your breath to leave your body slowly and gently without forcing it. So you can continue this again for up to 10 minutes as you need to. Then there's 4, 7, 8 breathing. This is also called the relaxing breath. This acts as a natural tranquilizer for our nervous systems. So the first and best way, I think, to do this is by actually sitting down with a straight back. And I think you can perform this again while you're just lying in bed at night time as well, once you've got used to making use of this. So you place and keep the tip of your tongue against the ridge of tissue behind your upper front teeth for the whole of this exercise. You completely exhale through your mouth, making a whoosh sound. Close your mouth and then inhale quietly through your nose to a count of 4. Hold your breath for 7 and then exhale completely again through your mouth, making a whoosh sound to a count of 8. So 4, 7, 8 breathing all the time with the tip of your tongue against the ridge of tissue behind your upper front teeth. So very, very simple exercises. And what I would say is that it's really, really helpful to make up a best breathing timetable and practice it daily. Like anything, you get better with practice. So I hope this is useful. There are some very simple techniques here. And I think at this moment in time, exam periods, the whole exam schedule that's up and coming for many of our children and people now, this is a time when we need to be engaging in our deep breathing, our best breathing more than ever. I think it's important. Make a timetable, have a go, keep practicing and see what works for you. But if you feel that this is a huge, huge issue and this is not helping, I really do recommend you must go and see your GP, ask your doctor who can help and advise you on accessing some additional support, because it's okay. It's okay to feel anxious. It's okay to have that sense that we're feeling overwhelmed, but it's not okay to feel like that all the time. So create your own toolbox of well-being. Find out what works for you, which of those breathing exercises. It's trial and error. You put in your toolbox what works most effectively for you, what works best, what you need to do more of is something that you can identify through your daily practice and keeping that best breathing timetable or journal. So thanks very much for listening, and I hope that this has been helpful.